These were out at sea. It was very impressive one day. We were out there. We were off Yankee Station.
Chuck Cummings loves to show off these pictures, shots of a young Navy man in the prime of his life. He managed to maintain the energy of his military days until a few years ago when he was diagnosed with heart failure.
I used to like to wash the car, and by the time I was done washing the car, I was too tired to do the interior.
Doctors said Chuck's blood pressure was too high, preventing his heart from pumping enough blood to the rest of his body. That's when his wife, Ann, found a clinical trial to hotwire his heart.
Well, I guess my wife must like me because she wanted to keep me around, and she started searching the internet.
This is the generator.
Chuck was the first heart failure patient to have the device implanted. Surgeons insert a battery pack, no bigger than an iPod, under the collarbone and place electrodes around the carotid artery in the neck. When the pack pulses, the electrodes stimulate the artery, telling the brain to relax the heart, which can then fill up with enough blood and pump properly.
It's like a switch on and off.
In an earlier trial to combat high blood pressure alone, the device helped patients on average lower their numbers from 180/158 to 105/87 in 3 months.
What we're trying to do is to improve the quality of life and make them function and do things without necessarily having to take tons of pills, because medications, they have their own side effects.
After 3 months with the device, Chuck doesn't take any heart medications and hopes to keep it that way.
I seem to have a little more energy. I can be on my feet longer, do more.
So now those long walks with his wife aren't so long anymore. I'm Melissa Medley reporting.